Hey y'all, hey, it is me. It is your girl, Nurse T. Hold up, it is your favorite Nurse T. If you're new to my channel, welcome, welcome, welcome. And if you're a returning subscriber, thank you very much. Who said that in the words of Elvis Presley? Thank you very much. But anyways, y'all, hey, I am so excited to make this video. This video is for those of you who are aspiring to be a nurse, those of you who are this close to starting your nursing program, or those of you who are just still kind of confused about, is nursing for me? And if nursing is for me, how do I prepare myself when I start my nursing program? So without further ado, go ahead and grab your pen and your paper, or your note card, or your phone, the note section of your phone, whatever it is you got to do. So let's get this on and popping. So before we get started, I just gotta let y'all know your girl got her notes right here on her phone because I don't want to get sidetracked. I don't want to get distracted because your girl can get distracted. So anyways, y'all, without further ado, let's go ahead and get started. So my number one thing I suggest you do is have some type of a planner. When you start nursing school, you want to have a planner, especially if you start nursing school as a mother, or if you're going to be working and you need to be able to know what dates that are important. I'm sorry, y'all. This is so ghetto. All right, y'all. So it is very important to keep some form of a calendar, a agenda book, a planner, whatever it is that you're going to be using to jot down your important dates and information, because you need to make sure that you're recording, taking notes on days you have clinical rotation, your weekly scheduled classroom assignments, like time that you want to allow for studying, meeting with your study groups, all that good stuff. Make sure that you plan that stuff out. Make sure that you allow time to prepare for the upcoming tests, assignments that's due, projects, and like I said, clinical rotation. One thing about clinicals is they can vary, they can change, and you don't want to be stuck, especially if you're a worker, if you have a job and the days you end up double booking yourself to be the same place at the same time, if you need to be at clinical or at work on the same day, same time. But anyways, make sure you have some type of a planner to keep track of your assignments, your clinical rotation, and any study stuff that you want to put in there. All right, y'all. This next one, number 2, is very, very, very important. You want to make sure you develop good study habits. You want to make sure that you are learning the material to learn the content. Let me say that again. You want to make sure that you are learning the material so that you are learning the content. Okay? Not just memorizing. There will be areas where you will memorize things like lab numbers, formulas, but when it comes to learning about diagnosis and disease process, everything feeds on top of each other when you're in nursing school. So what you learn in semester 1, you might see it again in semester 4. So make sure, and basically it will build on each other. So if you don't know the content, you will really set yourself back. And let me tell you, when I was in school and when I took the NCLEX, it was basically over content. You needed to know content before you can do those practice tests. Especially, I know things has really changed as far as with the NCLEX 2024, but when I graduated 2015, we had a lot of select all that apply. And if you did not know the content, sweetie, you wasn't getting that question right. And it was no partial credit. Okay, so make sure you know the content. So what are some ways, Nurse T, teach me. How can I learn the content? Again, not everybody are readers who read from the front of the book to the back of the book, from the front of the chapter to the end of the chapter. However you go about reading your chapters, whether you skim first, looking at the bold printed letters, and then going back and reading. I read, because if I don't know it, how am I going to skim it? So I read. And then I made note cards. Let's see what else I had on my little checklist here. I did concept maps. When they give you those study guides or like the blueprints, make sure y'all fill that out, because the majority of it is on your test. Practice quizzes, practice tests, practice questions. Make sure you're using that. We used to do questions in the Saunders book. The Saunders book or your HESI book, whatever they're using these days. Make sure you're practicing questions over the topic that you finish, because sometimes you think you know something until it's time to answer the question. Like, you know the content, but can you apply it, y'all? Moving right along. Let's see what I have next. Prioritize self. Y'all already know. If you follow me on my socials, your girl I'm gonna make sure I prioritize myself. Because remember, you can't pour from an empty cup. You cannot pour from an empty cup. So remember, prioritize self. Nursing school could be stressful, emotionally draining. Make time to exercise, meditation, and any type of relaxing techniques that you can do. It doesn't have to cost. If you can, to me, spa days always relax me. If I get a mask from the Dollar Tree, if I have a bubble bath, if I have some candles lit, 10 minutes to myself, 10 minutes undisturbed, 30 minutes, an hour, whatever you can afford to dish out to yourself, make time for yourself. Working out is a form of self-care. To me, like they say, working out releases endorphins. It stimulates something that keeps you happy. To me, I feel like working out is like taking a shower to me. If I don't work out, I feel dirty. I feel icky. I feel like I'm full of toxins. I feel like when I work out, I'm cleaning the inside. And after the workout, I feel like I released something. I feel like how you feel after you take a shower. I feel like rejuvenated or something. Even if it's a run in the park, like some form of physical activity for at least 30 to 60 minutes a day, you owe it to yourself. Remember, 30 to 60 minutes a day, and we have 24 hours in a day. That's not much. 30 to 60 minutes a day out of 24 hours, you owe that to yourself. So prioritize that. Turning everything off, shutting everything down. Put on something relaxing and just meditate. Just feel it. Just have that moment. If it's not once a day, twice a week, have that moment, because you owe it to yourself, and you would need it, because when you do that, you don't realize how further you can go, how much more you could take in. Because when you don't release yourself, so much buildup could put you on a road for destruction. So yeah, prioritize self. I'm going to read from here because I don't want to miss nothing, and then I'll just elaborate. The next one is build a support network. Connect with classmates, join study groups, and seek mentorship from experienced nursing. I think it's great to form study groups. That's great. But make sure that everybody's on the same page. Make sure that everybody is putting in. And not only that, make sure you know you. I can recall when I was forming my study groups, I had to learn myself very quickly, because a lot of times, if we coming together, we can't come together and study, read together silently. I like to read to myself, and then in my study group, we collaborate. we feed off each other's mind. Because my way of thinking sometimes your girl be totally off. But sometimes you have your way of thinking and what you feel is important. They have their way of thinking and what they feel is important. And then collectively, all together, we can collaborate, because it might be that very moment that this person over here says something and you remember what they said, and that might be on the test. It might be stuff on the test that you didn't really focus too much on, but somebody else did, and they brought it up in the discussion. So make sure you do that. And that other part about the nurse mentorship, it will be of your best interest if you have a nurse friend, and you have a nurse friend that can be there for you. One thing I like about this YouTube platform is that you could reach out and you could connect. You could reach out, you connect with those who are going in the direction where you're going, who've been where you've been. And people like myself, I'm a very open person. I'm a very helpful person. If you have a question, you could drop the comment down below. If you have any questions regarding starting the nursing program, drop it down below. You will need a nurse mentor. You will need a nurse mentor, someone who's been down this road, because sometimes it takes you to just having someone to break something down in real life experiences, or break it down into a relatable experience. Having somebody at times that just look like you, who didn't have the best way of getting through nursing, but they got through nursing school, that is. Just having a good mentorship, knowing someone, utilizing your peers when y'all all on the same page, and utilizing good study techniques. The good thing about study techniques is that try all forms of studying as you can, because the beauty about trying study techniques is that if whatever you didn't work out, you know what not to do the next time you take a test. So I knew I had an option to read the chapters, and most of us we're not reading all that. I had an option to read chapters, record lectures, make flashcards, do the blueprint, study guides, do practice questions, do a study group session, do this, do that. Let's say when I was taking critical care, I've probably utilized 3 of those, and I made a B the first test, and I felt like, oh Lord, I'm killing myself with a B. We don't want to do that, because if your highest grade is a B, and supposedly those tests gets harder and harder, and then you get a C or a D, that B is going to drop down. So at least let your foundation be high. At least go into your first test trying to get an A. Whatever you do, try to get an A. Okay, so if you fall short, at least you won't be brought down too low, because it's hard to pull up if you have a low grade. But anyways, let's say that I utilized 3 of those techniques and I made a B. Okay, so next time we fit to try to do more techniques. So if the first time all I did was skim the chapters, did the study guide, and got with the study group and I made a B, okay, next time I'm fit to make sure I'm listening to the recorders, the recording when your teacher's up there pre-teaching. Make sure you're recording, and I'm gonna tell you, word from me, from an experienced nursing school student, as they are lecturing, if you're not actively listening because you're too busy writing, that's called being a passive learner, not an active learner. If you're not actively listening, you will be missing a lot of stuff. So what I used to do was I would take notes in one color, and then when I go home and study, I would listen to the recorder, and anything that I didn't hear that was lectured when I was actively in class learning, or passively in class learning, I would write whatever I heard different on that from the lecture. I would write it in a different color, and you'll be surprised how much of a difference of stuff that I was missing because I wasn't actively learning. And even if you are actively learning, you're in a state of asking questions, doing this and that, so you might miss a few things. So anyways, when it was time to take the test, I would notice that it was stuff that the teacher would emphasize over and over I would put like a little star by it because I was noticed that it would be questions from the test. So make sure you're utilizing all your study techniques. Yeah. So anyways, moving on, y'all. Let's see. Okay, so practice critical thinking and problem solving. Nursing requires quick thinking and effective decision making. Develop these skills through scenario-based exercises and case studies. Y'all, case studies can be your best friend because case studies would determine if you know the content. Let's just make this quick, this section quick. But what I'm gonna tell you what I used to do. Anytime I'm getting ready to take a test, I would ask myself a question. T, if somebody came to you and asked you what is diabetes? What is diabetes mellitus? Like, what would I tell my patient if they came to me and asked me about the pathophysiology of diabetes, DM, diabetes mellitus? If I can't look in that mirror and tell my patient exactly what diabetes is and how is it formed and how is it treated and what kind of nurse interventions that I need to know, what type of test is used to determine when it comes to diagnostic, how do they diagnose this? They use a hemoglobin A1C test, okay? What are some classical signs and symptoms that a person will present to you? How would they present to you? Sweaty, which is diaphoretic, sometimes lethargic, because half the time when they find out they're diabetic is after their sugars are already elevated. Just how would they present to you? Know what causes diabetes. We all have cells. We know our body is made up of cells, right? Our bodies naturally produce, our pancreas, we produce insulin, okay? So the food we eat, it has sugar, carbs that break down into sugar. Okay, so the sugar that is broken down from our carbs that we eat, that sugar is supposed to go into the cells, which gives us the energy to keep going, right? So with diabetes, either your pancreas is not working or it's not working effectively. So when it releases that insulin, which supposed to grab the sugar and drive it into the cell, to give us the insulin that we need, give us the sugar that we need. With diabetes patients, that sugar is hanging out in the bloodstream. It's just hanging in the bloodstream. It's too much sugar in the bloodstream, y'all, basically it's diabetes, right? So too much sugar in the bloodstream, it can clog arteries, veins, that's how like our eyes are highly vascularized. You see all the little vessels. So when those vessels become clogged because of the blood that flows to keep our vision going, have this specks of sugar hanging out in the blood instead of in our cells. That's why most people get diabetic retinopathy, which is what the number one causes of blindness in diabetic patients. Then also, again, hangs out into the cell, into the blood. So it's clogging up those arteries, those veins that causes the blood to flow through our extremities. And what happened with the vessels being clogged, you have a lack of blood flow, and a lack of blood flow can lead to neuropathy. So that's why a lot of diabetics have diabetic neuropathy. Again, don't take it from me. I'm just a nurse. I'm not a doctor. Small disclaimer, I am not a medical doctor, nor do I desire to be one. However, your girl gonna let you know a thing or two, okay? So let's move right on, right? The next one I would say is seek help immediately if you notice that you don't know what you're doing. Or if you notice that things are not looking too great as far as in my testing grades, as far as in what I'm learning. If you don't understand something, get with someone. Sometimes it's the delivery. Not all instructors can deliver a message or teach a class. Okay, so I found it very beneficial when I had people who've actually had real life experience, who worked in certain areas. When they taught the class, they taught and gave real life experience in that area. But unfortunately, with the nurses shortage of professors, this and that, sometimes you can just roll up in there and get you a job and probably don't know a lick of what's going on. But because you're a nurse You could have been a baby nurse or whatever, but they have you teaching about what's going on in the ER, whatever. Basically, or you could have been a psych nurse and they got you teaching mother baby. Like, no, like point me in the direction of the person who had that experience. Sometimes it might not be that way. So what you got to do, you got to jump out there. You got YouTube. You can go out there and go to YouTube University. Or get with someone, that nurse mentor, and find out how can you develop the knowledge and the skills to get you to pull you through this class. Because you don't want to just be sitting there and passively failing. You don't want to do that. All right, y'all, let's jump to the next one. Take care of your physical and mental health. Get enough sleep, eat well, and prioritize mental well-being to avoid burnout. You definitely want to take care of yourself. Eat right. Don't eat too much, what is it called? Low vibrational food. Eat things that's going to help stimulate you. Eat clean, have a healthy diet, and don't forget to work out. Stay focused and motivated. Remind yourself why you wanted to become a nurse and celebrate your progress along the way. Don't never lose sight, y'all. Don't lose focus. And when you do, always remember your why. Why did I get started into this in the first place? Your why will often bring you back full circle and get you back where you need to be. Are you doing this for you? Were you forced to do it? Do you have a reason why you're doing it? Because once you know your why, the how is left up to him. How you going to get it done? Because, baby, let me know when you're ready to know my story. Your girl did not have it. I didn't have it handed to me, boo-boo. I did not. So let's just stay on topic. But however, don't forget and know your why. Why did you start? Lastly, we get into the end. And I'm going to try to sum everything up very quickly. All right, use technology to your advantage. Utilize digital resources like nursing apps, online tutorials, simulation tools to enhance your learning. We have so many apps, y'all. Like, I used to personally use NCLEX Mastery. Whenever I would finish an assignment, learning about a topic, I would go to that topic. On the NCLEX Mastery app and practice. And if I find myself failing more than I am getting right, that means it was time to go back and revisit the content. You also want to subscribe to like nursing journals so you can stay current with current events, things of that source. Okay. And then develop effective communication skills, practice clear and empathetic communication with patients, families, and healthcare teams. Y'all, the time to get to be scared and to show that you're afraid and this and that is when you're in nursing school, because they empathize with you. They know that, okay, she's the student. But when you come into your real life patient room and you acting like all frantic and timid and this and that, they're going to be like, baby, point me in the direction of the next confident nurse, the competent and confident nurse. Don't bring your timid tail up in here. You might have some people give a take that say, okay, baby, go ahead. But no, let me tell you, when it's their life at stake, they're not going to want no timid nurse touching them. Because the chances of you being timid, the chances of you making a mistake is very high. Okay? The chances of making a mistake is very high. So don't get timid. I'm going to use that as an example when you drawing blood. Okay? A timid nurse, let's say you have a nurse who knows that a patient has a certain background. And y'all know what I mean by that. Certain backgrounds with blood-borne infections. Okay? Like, you got that. They got a little infection in their blood. And you know that that's transmitted via needle stick. Now, you take your tail in there and you scared to stick this patient and you shaking and you doing all of this. What's bound to happen? You bound to probably stick yourself. That patient gonna jerk back because you don't know. You coming at them like this with a needle. They gonna jerk back. You run the risk of sticking yourself. But if you are competent in what you're doing and confident in what you're doing, you're going to get in there and get it out. I always tell people, when you have to stick a patient that you know have certain infections, treat them like you treat everybody else. Treat people who you know don't have infections as if they have infections, because you never know. How many people are walking around here just sporadically getting their tests checked to make sure that they don't have any bloodborne infections. Sometimes they don't know until something comes up and they have to be tested for things, you know. Or half of them know that they probably, you know, whatever, but they just still not getting tested. But anyways, y'all, let's just sum this up. I just want to say, remember, nursing school is challenging but rewarding. Stay committed and you'll become a skilled and compassionate nurse. Let's emphasize on compassionate. Nursing school can't teach you how to be compassionate. That's usually often naturally innate when you're born, innate within you. That's if you're not a passionate nurse. I'm not saying you can't be a nurse. Maybe you can be that nurse in the jail cell, in the penitentiary, or wherever. There's a place for you. Maybe you're gonna be that nurse in the courtroom who has to show up and you know, with her chest up and her shoulders back and care less about your feelings. Okay, because you know y'all good for coming after nurses for anything. Nursing could have had a nurse could have been stopped on the street. Had nothing to do with her nursing career. We have a registered nurse that ran the red light, blah, 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 blah. Like, what does that have to do with her nursing career? Y'all be killing me with that. But anyways, y'all, thank y'all. If y'all made it this far, go ahead and drop me a pink and a white heart. Because I'm wearing pink and white today, y'all. Drop a pink and white heart. Let me know y'all made it to the end of this video. Let me know if y'all appreciate this video, you want to see more like it, or if you want me to dig deeper on something that I taught you through this video. As always, thank you for stopping by my channel. If you haven't already, please go ahead and like the video. Keep your girl in the rotation. Leave me a question. Just thank me if you liked it, or whatever I can improve on. I'm open, y'all. Again, I know I read off of this thing, but girl, I would be all over the place if I don't. I still feel like I was getting a little all over the place. But anyways, you rocking with your girl Nurse T. Thank you for watching me, and I look forward to seeing y'all on the next one. Bye.